Try this again. Let's try this again, alright? Let's try this again. We live again on, what's today, the 16th? April 16th, 2025. Finally getting it in my head that it's 2025. I kept saying 2024 for the longest. It's 2025, and the days been going by quick, man. We're already at the middle of April, and time is moving. Time is really moving. This podcast live is designed is published. I put this out there to help anybody going through cancer or any family member going through these same issues. If you have any questions or any comments, whether you are a cancer patient or family of a cancer patient, please put your question in the chat or find my email on my homepage and submit your questions. All right, submit any questions you have. So I can help you out if I can. So got some wonderful news today. Some great news today. Going to the cancer center because I have to go there 3 times a week to get blood and platelets because of my current condition, which is I'm in recovery mode from chemotherapy because I just underwent um, rice chemo treatment. Um, this is a very harsh chemo treatment. Uh, Cancer lapsed from the first time in 2021, so they had to find stronger chemo treatment for me this time, and I can't say it worked. The chemo treatment that I just received in January, beginning of January, it held me in the hospital for about 2 or 3 months. Recovery, I was supposed to be out probably about a week, but due to my situation and my immune system and my ability to recover, I had to have an extended stay in the hospital. So I'm just getting out it's been about a month since I've been out, and that month being out has done a lot for me on regaining my strength. Um, the most important thing is regaining your strength and regaining my thought process because um, it was very hard to formulate thoughts afterwards because of the damage of the chemo. So you know, fortunately, once you undergo these chemo treatments, you get things start growing back, start building back. So, I guess my brain cells got built back or something, but I do feel a lot more alert, a lot more conscious. My brain is working way, way better than when I first came home in the beginning of, in the middle of, in the beginning of March. So, yeah, man, I'm just, happy to be alive today, because, it could be a lot worse. Chemo and cancer affect everybody differently, and especially mine came back on me. You understand what I'm saying? So this time around, it could affect it so much. Yo, Piff, what's going on, bro? What's up, Piff? What's up? Yeah, man, shit is real, boy. Shit is real. But, through the grace of God and all the prayers from everybody, family, friend, everybody out there, I'm doing a lot better, as you can see. My movement is better. You know what I'm saying? I was looking like I was hurting. I was looking like a straggler a month ago. But thank God my wife is a great cook, and she knows how to whip. So you know what I'm saying? Hey, Piff, hey. I can't say you a better cook than my wife, but you be hooking it up, man. I be seeing you over there. You know what I'm saying? Taking care of them babies, man. That's a hell of a thing you're doing over there. Every time you post, that shit look good, bro. Keep it up, man. Yes, keep it up, keep it up. Yeah, man, I got some wonderful news today when I went to the cancer center. Yo, what's going on, Mike? What's up? What's up? What's up? What's up, Michael? So I got some great news today. My PET scan that I told you, which scans the body for cancer, that came back negative. Whoa, cooking that crack chicken? Shit. They're gonna be lined up at the door. They're gonna be lined up. Yeah. PET scan was negative for any cancer, and bone marrow biopsy I did, and I was waiting on this result. For some reason, it takes long as you know what I'm saying. I don't know what, but finally got the bone marrow biopsy back, and according to the doctors, I have no more cancer present in my body at the moment. Nowhere in my body is there any cancer. Now, um, give thanks for that because that's the that lets you know. Amen. Amen. That lets you know what's going on and how bad things are is the bone marrow biopsy because that is you know what I'm saying. I go straight deep to your cell production and depending on the kind of cells you're producing, it tells you right off um, what's going on. So thank God the bone biopsy came back. No more cancer in my body. Thank the Lord for that. And now once that is done, we move on to the next phase, which is a bone marrow transplant. Yes, I got the news today that like I told you before. I think I told you this. They found two donors, but they was waiting on the bone marrow biopsy. So you know what I'm saying. Appreciate it. 'Cause I got the bone marrow, so now it's time to do the transplant. And you know what I'm saying. Like this is what I've been waiting for. I didn't even know in my first diagnosis. You know, I guess bone marrow transplant was not the go-to, right? Unless you lapse. Even though I had three cancers at the time, the chemo that they gave me kind of like took care of everything for that moment. But now I'm able to do this bone marrow. I mean, not the bone marrow biopsy, but this bone marrow transplant, right? In about a week or two, 1 or 2 weeks from now, I'll be I'll be able to do. So I'll be back in the hospital another week or two from now to do this bone marrow biopsy. My doctor's telling me this is the fastest turnaround because the donors, right? The bone marrow is coming from a donor. It's coming from a stranger. Um, and usually, a lot of these bone marrow transplants come from Germany for some reason. I gotta find out why that is. But you know, usually these transplants come from Germany. So I was fortunate to find two donors, but the donor is not available in May, right? Because you have to work with people's schedule more so theirs than mine, and they're available. They're not available in the end of May, but they're available in now. So within the next week or two, um, we will be in the hospital ready to do bone marrow transplant, ready to stay. Because once you do the bone marrow, you have to get watched, and there's so many things that comes along with the bone marrow transplant because you got to go through chemotherapy again to weaken the body. You weaken your own immune system so you're able to, you know what I'm saying, you're able to take on the donor's immune system. So my own immune system has to get pretty much uh, damn near removed to make room for the donor's um, bone marrow stem cells, basically. From and the whole purpose of it is my bone marrow um, has the ability to create cancer cells for whatever reason. Currently, there's no cancer cells, but the chance of it coming back is very high due to the fact that only after a year and a half of a remission, my cancer came back again. So they're gonna wipe out my own bone marrow to make space for my donor. So I'm gonna have to go through a lot of the same thing I went through before with the infections and a lot of things. It's possible. I'm not gonna say it to go wrong, but I have to stay in the hospital for a month after getting the transplant to be watched to make sure everything is okay, to make sure I don't have any rejection with the bone marrow because it's possible that my body will see this stem cell as foreign and attack it. So that's the best way to do it is to reduce my own immune system. And then again, the donor's stem cell might find my body foreign and attack my own cells. So there's a lot of risk involved in doing a bone marrow transplant, graft rejection. And that's when it's like anything else. It's anything foreign. If you have a kidney transplant or whatever transplant you may have, and your body might reject the organ, it's possible for my body to reject the donor's blood, or the donor can see my body as foreign. And because if you think about it, the donor's blood is going to be pumped into my body. It's going to be a good amount. So it's possible that the donor's blood can, go against me and affect me negatively. So there's a lot of, things that can happen, and that's why I'm gonna have to be in the hospital for another month after infusion to make sure that everything goes properly, and all the drugs that I'm gonna be getting. Hopefully, they they're gonna test to see if I'm eligible for this trial that they have. That's gonna help me with the process of not being the blood not being rejected. So hopefully I get accepted in that program. But there are options. There are different drugs that are given out to there are different drugs that's given out to help. Yeah, there are different drugs that's given out to help with the process of the new cells in your body not being rejected and not causing, it worst case scenario, they say it can cause death. You know what I'm saying? Like, there's a lot of risk involved, but not a high percentage, and I'm not afraid. You know what I'm saying? I'm blessed, so I'm ready. Doctor is like surprised to see my energy and to see where I'm at, and I'm just excited. Asked me today, you have any questions? I couldn't come up with a question. I'm just ready to get this process rolling and to, what I'm saying, get my life together. So, what I'm saying, I could be out here doing whatever it is that I want. Um, so, in the next week or two, I will be heading back to the hospital, so I can get this bone marrow transplant. That's amazing, and there's a lot of people from what I've seen, there's a lot of people undergoing this bone marrow transplant. I didn't even know that there was that many people that do bone marrow transplant, but it seems like this problem is you know it's not just me, and it's not, what I'm saying, like, I was kind of surprised to see the amount of people that, because once you go on the cancer floor, they got a whole section that's specially designed to house the transplant patients. And in this area, there's only one patient per room to reduce the chance of any sickness or anything, anybody, you know, any sickness or anything happening. So I will have a room by myself. I will have a nurse, my own specific nurse that's going to make sure everything is okay. So, what I'm saying? It's coming, man. It's coming. They said I should be back by, by June, July, I should be back. You know what I'm saying? I should be back. I should be having a barbecue this summer. That's a fact. hopefully July, August, you know what I'm saying, sometime around there. Hopefully by the end of August. Anywhere after July, I should be having a nice barbecue. You know what I'm saying? For everybody that's asking, you know what I'm saying? I had a friend, my boy Bob came by yesterday, you know what I'm saying, to pick up some stuff. He's like, yo, when you gonna be back? Barbecue this summer, you should be back by July. I'm like, yeah, I hope so, you know what I'm saying? So, you know what I'm saying, keep praying for me that everything goes well. And I'll be back. I'll be back out there. You know what I'm saying? And in a couple months. That's what's up, my bro. Yeah, Piff. I'm getting back, man. And it's like I know I'm never gonna be the same person that I was before, but just to be able to do some of the things that I used to, and to put this behind me because this cancer thing really took a toll on my life for the past, ever since I was diagnosed in 2021, and the difficulties that I had to, yes, I need my jerk chicken. Yeah, yeah, and yes. And it's crazy. That's my wife talking about, yeah, I need some jerk chicken. You know what I'm saying? She's right here with me, you know what I'm saying? She talking about she needs some jerk chicken. Imagine, you know what I'm saying, all our friends that's out there. Like I'm telling you, like for some reason, these people love this jerk chicken. You know what I can do. I gotta give it to them, right? And you know what I'm saying. I'm share the story of my wife's um, my wife's surgeon, my wife's stomach surgeon, um, one of the best or the best in the world. You know what I'm saying? Would you say, Piff? Just to be able to do some normal shit. I understand, bro. Word, man, cause the what my biggest issue was when I was going through this. Everything was so crazy that it was not it was not what the doctor expected. So instead of me just continuing with my life, you know what I'm saying? Because the doctor looked at me and was like, yo, the cancer you have is on this side of the spectrum, and you're on this side of the spectrum. You're not supposed to have this cancer. You know what I'm saying? So there was no explanation of how, why I ended up with with actually two, and then they found out I had a third cancer after they did some more research, mainly bone marrow biopsy, to find out what the problem was. And maybe if I was able to do a bone marrow biopsy before I started the first chemo, it might be a sign of something. So, this is a recommendation if it's possible. Try to do a bone marrow biopsy before, what I'm saying, the chemo gets started. I don't know if that's a real thing, but that would be preferred because my system did not recover for months. Usually, you're supposed to go, my first chemo treatment in 2021, every 3 weeks, you're supposed to go do chemo. And sometime it took me a month, sometime it took me 2 months to recover to do my next treatment. Instead of a 3 weeks, it took 2 months. And my doctor was like, yo, I don't want to kill you. I need to find out why your body is not responding to the treatment or to anything. So, you know what I'm saying? Took time out, did a bone marrow biopsy and find out that there's leukemia markers also in my body that's preventing me from a rejuvenating self, right? So, oh, bro, shout out to the queen. Shout out to the queen. You ain't, bro. That's some real, like, bro. Shout out to the queen. She held me down. I think one of the most important things she did for me was while I was in the hospital, like she took care of me. Like she really had to like take care of me. Like, cause I told y'all on the last podcast Monday, like I was literally non-responsive in the bed for 2 weeks. Like defecating all over myself, couldn't control my bowels, like it was nasty. You know what I'm saying? And between my queen and my mom, like they cleaned me up every single time, changed the sheets, like you know what I'm saying? I'm so appreciative, I'm so thankful for how they treated me. You know what I'm saying? Like they didn't wait no time. They didn't wait till he shit again or none of that shit, you know what I'm saying? And every time, and I was doing it like every hour. every hour I would have an accident. You know what I'm saying? On myself. Hey, what's going on? What's going on, Agnes? Hey, what's going on, Agnes? Every hour, every so often, I have an accident on myself, and they would just take care of me, man. And that made me feel so good to know that, you know what I'm saying, my mother, you know what I'm saying, my mother, they give thanks to my mom, she would be there, you know what I'm saying, and held me down, and it was a moment. It was a crazy moment to go through, you know what I'm saying, and it was what's going on. Yes, yes, it's a blessing to see you here as well. Thank you for joining in the live, man. You know what I'm saying. You know what I'm saying, listening to our little shop talk about cancer, about survival. You know what I'm saying? And when I was first diagnosed, I was 38. Now I'm 42. You know what I'm saying? So cancer can happen to anybody at any age, and if you know what I'm saying, and if you know what I'm saying, as you get older, you're more susceptible to getting cancer. You know what I'm saying? Sorry to say this, but the truth is, the older you get, the higher risk of cancer. You know what I'm saying? So if this information isn't helpful to you now, hopefully it'll be helpful in the future. And one of the most important things is, and I didn't say this in my last live, is what I'm saying, please go and get some blood work done. Please go and get checked out. You know what I'm saying? Get a urine test. Men, we need to go out there and get our urine test, get our PSA, find out what's going on with our prostate. Make sure that we are doing the most we can. You know what I'm saying? Because think about it. For the whole year to go by, all you gotta do is once, maybe twice, go get your blood checked. And it's always good to know what your baseline is. Meaning, you're at a certain health level right now. 2 3 years from now, when something go wrong, you can always look back and see like, oh, this is when something started changing. What was I doing at this time? 2026 in December. Where was you at? You know what I'm saying? Because your body always tells. That's one of the reasons I knew that. And I start talking about one thing and then just go to the next. So just bear with me. One of the reasons I knew I was sick again because I let me go back to what I was saying originally. What affected me so much about my cancer, I told you the doctor was like, your cancer's on one spectrum, you're on the other spectrum. Like, old people supposed to get your cancer. Like, somebody like you is not supposed to get this cancer. You know what I'm saying? So when I asked the doctor, I was like, yo, what can I do to help myself, better myself? Meaning, what can I avoid and what can I go towards to help me in my situation? And my doctor looked at me and was like, yo, there's nothing I can tell you. Literally, there's nothing I could tell you. Only thing I could tell you is to go out there and enjoy your life. And I'm like, what? So I'm like, yo, I'm 38. I'm like, yo, I want to see another 40 years. You know what I'm saying? What can I do, or what should I do? What food should I eat? What things should I stay away from? And my doctor looked at me and was like, yo, and I understand, you can't tie yourself to any one thing. You know what I'm saying? I guess, there's liabilities or whatnot. But the doctor looked at me and was like, yo, just go out there and enjoy your life. And for me, that wasn't enough. I'm going to be honest with you. That wasn't enough to hear that from my doctor. So since 2021, I've been reading, researching, trying to understand what's going on in my body. And due to the fact that I had to get blood and platelets like today, I'm just coming from the cancer center earlier. I took a little nap. You know what I'm saying, because it takes so much out of me. One, because my blood is already low, so I'm already tired. So I had to get a bag of blood today, and I get a bag of platelets. And um, I forgot to tell y'all, and getting ready for this transplant. You know the little vials of blood they take when you go when you go to your doctor. Today they took 24 vials of blood from me today. 24 vials of blood, right? And this blood is to go to test for the bone marrow transplant. It has to go to different places, Red Cross, because I think that's where the blood is coming from. Other places or whatnot to check see if, you know what I'm saying, how well my body's going on, check for infection, check for all, I mean, 24 different vials of blood were drawn from me today. So if I didn't come there with a low blood count, by that time my blood count would have been low enough for them to give me a bag of blood. Yeah. Word, they took 24 bottles from me today. Hey man, I looked at the blood coming out. They've almost filled every vial. I'm like 24 vials. I'm like, yo, are you serious? But that's what it took. So, going back to what I was saying, not knowing what was going on with my body, I had to, I couldn't just live my life and not knowing like what's going on because these problems still exist. Like my immune system still